Mr. Speaker, we have been privileged, those of us who served on the Ways and Means Committee, to been advised by Speaker. I yield myself such time as I may consume.
Gentleman is recognized.
We had been designated as one of the three committees to work on this bill for the President and for the House of Representatives. And we were privileged to work with Chairman Waxman as well as Chairman Miller, and I don't think in the history of the Congress we've found three separate committees working in such cooperation. But as I said earlier, we had such hardworking, dedicated members and such a strong support staff that it's almost embarrassing that they are so limited in sharing with you the work and the time and the support that they've given to this important issue for the Congress and for our country. In any event, I have to admit as chair, there was one member that I relied on so much. He's the gentleman from California that since 1984 served as and continues to serve as the chairman of the Health Committee. And so it's with a great deal of pride that I call and yield 3 minutes to the gentleman from California, Mr. Peter Stark.
The gentleman from California is recognized for 3 minutes.
Showtime.
Mr. Speaker, today's vote will be the most important of our careers. History will mark which side we're on, providing quality, affordable coverage for all Americans or the status quo. I would remind my friend from Wisconsin that former Senator Bob Dole voted against Medicare, and that vote's haunted him ever since. It probably prevented him from becoming president. But since my first election, I've worked to see that government serves our people, and my top priority for 37 years has been to provide quality, affordable health care for all. I wish we'd done it sooner, but at my age, you learn to take what you can when you can get it. The bill is not the bill that many of us would have created on our own. That's the legislative process. The compromise before us today is the right thing to do for the American people. The bill guarantees health coverage to 96% of Americans. It's fully paid for. People who like their coverage indeed can keep it. It reforms health insurance regulation. It requires shared responsibility by individuals, businesses, and government. And it assures that health care is affordable for lower and middle income families. It fills the Medicare prescription drug donut hole and provides free preventive services in Medicare. It has the support of consumers, doctors, nurses, senior citizens, children, people with disabilities, farmers and small business owners, organizations that represent virtually every segment. And in my district, like every other district, Republican and Democrat, I've got 67,000 uninsured people who will be helped. 8,000 people with pre-existing conditions. 14,000 businesses will get tax credits. 8,300 seniors will have the donut holes filled. And every district in the country has similar numbers. I defy you to go home and tell those people you voted to deny them quality, affordable health care. And I'm proud to have helped author this legislation. I encourage each of my colleagues to join me in voting yes, and I can assure you these guys aren't going to have to pay for it in the future. I yield back the balance of my time.